Hi, my name is Allison Kostiuk, and today I'll be talking to you about a new nonprofit startup called Volunteer Engagement Services. According to the National Council of Nonprofits, the top 3 trends for charitable nonprofits will continue to be limited resources, increased demands on nonprofits stemming from increased needs in communities, the growing awareness that every nonprofit volunteer needs to be an active, vocal advocate for his or her nonprofit's mission to affect policies in the community and at a national level. So this is where Volunteer Engagement Services comes into play. It was founded in 2019 in the Metro Philadelphia, Pennsylvania area. The formal mission statement is, Volunteer Engagement Services is a nonprofit to help other nonprofits. The main goal is to support rare disease organizations in a cost-effective manner to recruit, train, manage, and recognize volunteers. So that's the formal statement. But if you talk to staff or volunteers that are involved with VES, what would they say the mission statement is? Here's a sampling of personal mission conceptions. VES fills the role to manage volunteers for nonprofits with small staff. Rare disease nonprofits are unique, and so are their volunteer needs, and VES can help. Why hire volunteer engagement services? Hiring volunteer engagement services is more cost-effective than hiring a full-time employee with benefits to serve a rare disease nonprofit to manage their biggest asset, their volunteers. Many rare disease organizations are only run by volunteers, and there are no paid staff. 7,000 rare diseases in the United States, according to NORD, the National Organization for Rare Disorders. And that accounts for 30 million Americans living with these rare diseases. In the United States, we define a rare disease as a condition that affects fewer than 200,000 people. So let's talk a little bit about volunteers. 25.3% of Americans volunteer, which is 62.8 million volunteers. They average 32.1 volunteer hours per person per year, which comes to just 8 billion hours of service, and that is the equivalent of $184 billion. So volunteer engagement services. Here listed in front of you is a menu of some services that we can provide for these rare disease organizations. We can help teach volunteers to be leaders and to lead other volunteers to keep them all on track of goals and to motivate the team. We have a full range of consulting services. We can also assist in clarifying roles and responsibilities of volunteer leaders and committee members. We can also assist in your volunteer conference development. We can also help to build a plan to help recruit and train local volunteers to do the following: to serve as local ambassadors for patients, families, and healthcare providers, to serve as a key link in the nonprofit's key initiatives through peer-to-peer connections, to build local communities, to report back to the nonprofit's home office. It can also build a solid plan to coordinate community fundraising events and to coordinate community educational events. So here's a quick look at the VES staffing and the volunteers. The staff is made up of an executive director who is also the founder, a client acquisition manager who acquires the nonprofit clients and negotiates each contract based on their specific volunteer needs, a people acquisition manager who recruits and trains these client success partners, who is the staff that partners with these nonprofit organizations. Also, the client success coordinators, which are the volunteers that also partner with these nonprofit clients. We have an administrative assistant who handles all administrative functions and all of the contract paperwork and the deadlines, etc. And then the biggest piece here is the contracted part-time staff, which we call the client success partners. They fulfill the volunteer engagement services contract with the rare disease organizations, and they assist these nonprofits with their volunteer needs. Our big two components of volunteers are board of directors, which is staff and volunteers from these different client rare disease nonprofits. And then, of course, our client success coordinators, which serve as the admin function in a volunteer capacity to assist the client success partners, our contracted part-time staff, to be that trifecta, the contracted staff, the volunteer admin, and then, of course, the contracted nonprofit. So at VES, of course, it is a strong volunteer and staff partnership, but so it is also a strong volunteer and staff partnership with all of our client nonprofits in the rare disease space. Most rare disease organizations may have one staff, may have two staff, may have a part-time staff, and some of the staff are actually volunteer staff that are actually not even being paid. So again, it is a true volunteer and staff partnership. A few FAQs. How do you measure and report on the effectiveness of your programs? VES has contract check-ins with the client nonprofit. What are the main obstacles that stand between you and your mission, and how do you plan to overcome them? The main obstacle is marketing our services to the rare disease nonprofit population and to fit in their tight budgets. Do you regularly have the resources to cover your budget? Yes, VES has the resources to cover the budget as we hire staff as the contracts are executed. How would you compare your programs and results to others working in the same field? VES is unique as others serve board of directors or overall consulting services. VES is specific to supporting volunteers in the rare disease space. What is your staff really good at? Recruiting and training volunteers to work autonomously in small rare disease nonprofits with limited staff and resources. So let's take a quick look at our board of directors. The board is made up of staff and volunteers from a few of the client nonprofits that VES serves. VES made sure to recruit the talent needed for each need, like someone in finance to serve as the financial expert and an IT expert to assist with technology efforts. VES also carefully diversified the board of directors to be able to relate to many clients. This offers the client nonprofits a look into the wide range of expertise on the board that reflects that similar talent in the contracted part-time client success partners. The main goal of the VES Board of Directors is to lend credibility to this new startup and to help recruit other nonprofits by using the resource-dependent approach as the board's governance model, being able to pull from their personal and professional contacts to advance the client database for VES. So what already exists in this space? From my research, I found BoardSource, founded in 1988 in Washington, D.C. But BoardSource really supports board members and leadership as they envision a world where every social sector organization has the leadership it needs to fulfill its mission and advance the public good. They believe the strong board and executive leadership is essential to the success of each individual nonprofit. And for 30 years, they have been working to inspire and support excellence in nonprofit governance and board and staff leadership. So here is a list of some of their services for their volunteer boards, which come from nonprofits, federated networks, charter and independent schools, foundations, corporations, leaders, and consultants. And it ranges everything from assessing performance, coaching and consulting, all the way down to certificate programs, forums, and retreats. VES wants to support the rare disease population. What exists in this space? So the National Organization for Rare Disorders, or NORD, was founded in 1983 in Danbury, Connecticut, and they really exist to provide support for individuals with rare diseases by advocating and funding research, education, and networking among service providers. Again, as we stated earlier, there are 7,000 rare diseases which affect 30 million Americans. So NORD, you are a member organization of NORD, and they really focus on policy and legislative issues, as you can see from their 6 benefits, from peer networking and guidance to advocacy updates to being listed in their newsletters. And then number 6, they really focus on a coalition with rare cancer. So a proposed partnership, collaboration, what's the next step for VES? The board and staff of VES looked at services of both NORD and BoardSource and realized that the collaboration or partnership that makes sense is with NORD. An external driver of collaboration is the main reason for this thinking, as the changes in the volunteer environment require more support. NORD has many member benefits that we just went over, but specifically training and managing volunteers is not one of them. VES would help fill this gap in services to this special group of nonprofits. Merger, partner, collaborate. Where do we go? What do we do? I like to use La Piana's collaborative map to illustrate the different stages of mergers, partnerships, and collaborations. Honestly, VES could go anywhere from remaining independent, cooperating with NORD to serve clients, maintaining independent programs, or just merging the back office operations to pursue shared goals, just to name a few. So here's the collaborative map. As you see from the rings, the gray, the purple, the green, as you move into the green, you get more and more merger and then acquisition. But VES could just simply start with the gray and do some networking, some collaborative learning, maybe move to the purple, do some association work, some coalition with NORD, and then eventually merge. That's something that needs to be decided between the board members, the volunteers, and the staff between VES and NORD. So let Volunteer Engagement Services help your rare disease nonprofit manage your volunteers in a cost-effective way to get your mission-related work done. As of right now, there is no collaboration with NORD, just a pipe dream, I think, of this organization. But for now, let us help your organization better serve your volunteer population to get your work done. For more information on how volunteer engagement services can benefit your nonprofit, please contact Allison at info@ves.org. Thank you for your time.